I'm Yvonne Hamoud, registered social worker and owner of New Moon Counseling, but out of the office, I'm a mom, wife, daughter, sister, and friend. Join me each week as I sit with a special guest to discuss everyday things that impact our mental health. We'll be chatting about everything from mental health and relationships to media and current events, as well as personal experiences and reflections, all in the hopes of normalizing our humanness and helping you see that you're not alone. This is Outside the Therapy Room. Hi everyone, welcome to Outside the Therapy Room. Melissa is back. How are you?
Good. Glad to be back.
On today's episode, we wanted to have you back to talk about psychedelic-assisted therapy. It is making kind of a comeback, or it's new for some people. And I think we're hearing a lot about it in the media, looking about it in a different way. But I wanted to get you, an expert, to talk a little bit about what psychedelic-assisted therapy actually is. And so, yeah, thank you for being here to talk about that.
Happy to be here. I'm not sure I'm an expert, but I'm certainly glad to share my knowledge.
Yeah. So what is psychedelic-assisted therapy for folks who may not know?
Yeah. Psychedelic-assisted therapy, kind of a big umbrella because there's a number of different psychedelics that can fall within that. With Health Canada, so if we were to talk about legal access to psychedelic-assisted therapy, we're looking at either ketamine, psilocybin, or MDMA. And some people will even make a distinction between MDMA and ketamine not being kind of true psychedelics. Can think of them more as empathogens. So MDMA, for example, is more kind of a heart opener. Whereas psilocybin being a psychedelic, and psychedelic meaning mind manifesting or soul manifesting, can be a much bigger experience for people. And so understanding the nuance between the different types of medicine can help people make informed decisions about what might be a good fit for them.
And we were talking a little bit about how it's kind of making a comeback. And so in what ways have you noticed it, like psychedelic assisted therapy making a comeback?
Yeah, there's a lot more research. I was just pulling up some numbers before I came over, and there's something like 191 clinical trials that are being conducted right now, specifically around psilocybin. So, since the early 2000s, there's been an increase in research. Johns Hopkins kind of leading the way in terms of a lot of those clinical trials. A lot of the research we have has come from there. But I expect over the next 5 years, we're going to really see a boom when it comes to research. So right now, things like treatment-resistant depression has really been the focus of study. But there are clinical trials around things like chronic pain, around trauma, especially. So I anticipate we're going to see kind of further reaches of what these medicines can do for people.
You mentioned a little bit on what has kind of been researched, but it can be such a broad topic too. But in what ways have you seen kind of the benefits of it?
Yeah. That's a great question, and maybe 2 minutes in and we can already dive into the neurobiology of this.
Let's do it.
But what I find is, because I work primarily with psilocybin, and so how that medicine specifically works is it is beneficial for disrupting patterns of thoughts or behaviors, right? And so when you're working with your clients, and especially with treatment-resistant depression, there can be a real rigidity where people can feel very stuck. I want to change, but I can't seem to wake up in the morning and feel any different, despite all of my best efforts. And so we can get into these deeply worn neuropathic kind of grooves. And so what psilocybin can do is actually disrupt that. And so one of the analogies I like to use is it's like taking this medicine. If you're thinking about skiing and kind of skiing downhill, and there's all of these trails that are carved into the snow, it's really easy to continue to follow a trail. But let's say you're skiing and you want to go check out this tree over here. Going off that path can feel effortful if there isn't a trail to follow. And so what psilocybin does is it's almost like it gives this kind of fresh blanket of snow, where then you have the ability to be able to ski anywhere you desire. But where psychedelic-assisted therapy, the therapy piece, some of the magic really lies in the integration. Because if we stick with that skiing analogy, and if you don't find yourself going down new paths or new trails, eventually that snow melts and all of the previously existed ruts are there and return, right? So the integration is really, really important to take this big experience and start to weave it into day to day.
You touched into the therapy, and so what is the process? Because I think, again, you hear psychedelic assisted therapy and you just kind of focus on the psychedelic portion, but there is a process to it. There's the integration, like you mentioned, and so I love that analogy because it really helps to paint that picture. But what is the therapy portion of it, if you don't mind describing that a little bit more?
Yeah, absolutely. And then I've got more to say about neurobiology. We can come back to that. But kind of high level, we might think of the psychedelic assisted therapy as three kind of components to it. The first piece is preparation. And so you're right, a lot of times when people think about taking the medicine, they think about the trip or the medicine day or the dosing day, but there's actually a fair bit of work that goes into it to prepare people in order to be ready for a big experience like that. So psilocybin, for example, is very physically safe. It's found to be, there's kind of no neurotoxic events with that, associated with that. So I contrast that to MDMA that floods your brain with serotonin. That isn't happening with psilocybin. So from a physical perspective, it's a very, very safe medicine. From a psychological perspective, it opens huge portals within people. And so if you've had experiences that you have not acknowledged, that you've repressed, traumas that you've not wanted to explore, right, for very good reasons, taking psilocybin opens up that portal, brings everything to the forefront. And so while physically safe, psychologically can feel pretty risky for a lot of people. And when not done in kind of in a way that tends to set and setting, can actually be re-traumatizing for people. So I do have a bit of a concern when I hear, a lot of increased interest in people saying, well, I can get mushrooms on my own and I'll have a sober buddy and I might try and do this myself over the weekend. It's concerning to me because these portals that are getting opened for folks are big.
Yeah.
And so when I think about preparation, when I'm working with somebody, I really think of it as kind of three main tasks in that preparation phase. The first is always, and you would appreciate this, but therapeutic relationship, right? And so what we work on is building that safe container.
Yeah.
And so that co-regulation becomes really important, that people feel safe, that they feel connected, that they feel, sometimes I joke, I call myself a cosmic steward, right? Is that making sure that they feel really attended to, that any needs that they might have on that medicine day are being met and attuned to and responded to.
Yeah.
And I say that because that's often one of the challenges, right, is to allow ourselves to receive help and care.
Yeah.
And so a lot of times, right, people kind of fight that. I can do that on my own, or I don't need that. And so preparation is in part developing that relationship. So should you need any kind of support, right, that you're able to take that in when you're in that expanded state.
I imagine it can be really vulnerable too to kind of be in that state when you don't know what to expect. And
Incredibly.
So, yeah, having that therapeutic relationship is probably it's so important for regular talk therapy.
Yeah.
But I think in this situation, when you're not when you're in the trip in that process, you want somebody that you can trust and know is going to be there to take care of you and help you through it.
That is of utmost importance, right? If you don't feel safe with the person that is holding space for you, right, then you can get all kinds of protector activation that happens. Yeah. And this is where sometimes we can find ourselves having challenging trips, right? Is that if there are not conscious, right, but our limbic system doesn't go offline when we're taking these plant medicines, and so that feeling of felt safety, if that isn't there, all that protective responses show up, right, and can actually make that much more of a challenging experience. Yeah. And so having that therapeutic relationship, having the safety in the container, allows people to kind of lean in or to get more curious about some of the vulnerabilities that might be coming up. So that's the first thing, right? Really tending to that therapeutic relationship. The second is helping people set some intentions. And so, like I said, these medicines, psilocybin, can be a huge portal, but setting some intentions helps to give that some shape, some direction. But there's a bit of an art to that, because when people come in and they say, this is the experience I want to have, the art is setting clear intentions and then helping them to hold those very loosely.
Yeah.
Right? Because if we go in with the expectation of, this is going to be a mystical experience, I'm going to meet God, I'm going to be able to ask all of my questions and have them be answered, and this is what it's going to look like, right? No pressure.
Yeah.
That's a big experience you've just asked for.
Right.
And so setting those intentions, but holding them loosely in whatever way that might show up for you. Right? And so for some people, it is one of their most spiritual experiences. They do have that mystical experience that they long for. For others, it's much more somatic or cathartic, right? Where they'll find themselves crying, releasing, yelling, moving their body, letting go of all of this energy or all of this emotion that's been trapped in them. For others, it's you know, it can be kind of an autobiographical experience. They might be going back into some of those pain points. They might be going back into some of those traumatic memories or things that they're wanting to have corrective experiences around. And so no two trips are the same.
Yeah.
So setting intentions is really important, but then being able to let go. Right? Being able to trust that the medicine is going to show me this in the way that I need to see it.
Yeah.
And so we often talk about, you get the trip that you need, not necessarily the trip that you want.
Right. And it's like the flexibility of setting some goals and intentions, but with the flexibility.
Absolutely.
Yeah.
Absolutely. One of the things, you know, that as I've been working with many clients around this, and they'll come in, especially with treatment-resistant depression, they'll come in with, I want this kind of goal over here. And if they've had an experience where there's grief that's present, grief is such a profound experience that it can hijack some of those intentions, right? And it can say, oh, finally, here's space for me to show up, right? And so that's where that holding things loosely and simply allowing whatever is going to happen to be able to meet that with some curiosity.
Yeah.
So that's the second task of preparation. And then the third, as you can imagine, is addressing any concerns that people might have, right? So as people are setting intentions, I want to, you know, I'm thinking of a client specifically where he was approved for a trip through Health Canada for treatment-resistant depression. And because I practice from an IFS framework, this is how we were doing our preparation. And we were kind of acknowledging some of these parts. And we started to get curious about, what if depression is a part, right? What if depression is a dampening of some of the intense emotions that might be in there? And we started kind of exploring in our preparation, we started to explore, what if the depression lifted? What would you be concerned to find? And he so quickly named, I'm afraid I'd see a monster. I'm afraid I'd look inside and I would be disgusting, unlovable, right? Like these profoundly hurtful core beliefs.
Yeah.
And so what the depression was doing for him was dampening all of the pain. If that's true, right, then I can dampen all of that pain. And so with the intention of, I want to alleviate my depression, also brought on a whole flood of protective parts that are like, oh, but then do I have to see this?
Yeah.
Do I have to confront the parts of me that I am disgusted by, or that hold the belief that I'm unlovable? And so then we had to spend a lot of time working, getting permission from those protective parts, because the medicine, psilocybin especially, can be so powerful. We talk about it as dissolving the ego, right? IFS, we look at that as kind of putting those protective parts to sleep, right? We're overriding them. And so challenging trip, we can have those protective parts that are like, oh, no, this isn't safe. Let me hang on to control, right? And so then you get this experience where the medicine can just escalate, right? It can make things bigger if you fight or resist. And so a lot of preparation is coaching people to move towards whatever that is.
Yeah.
right? Is that if you meet a part you're disgusted by, can you move towards it? If you see a monster, can you ask it what it has to show you? If there's stairs, can you go up them? If there's doors, can you go through them? So that very human response of, I want to move away from the thing that scares me. Preparation with medicine is looking at, can I move towards, right? Can I find some curiosity to be able to explore whatever it is that's coming up for me?
And
Not for the faint of heart.
yeah. Because I mean, even while you described that, the depression kind of holding into these parts that are holding on to a lot of shame and wanting to have that control, like it's heavy stuff. And
Very
so
much.
that's why it's psychedelic-assisted therapy, because as you pointed out, like being able to find medicine somewhere and do that kind of on your own, micro dosing or whatever it is that, somebody's trying to do without that preparation, there can actually, at least it sounds like there can be a lot more harm that is done
Yes.
at times, right?
Yeah. And so people can actually end up re-traumatized, right, by having these unsupported experiences.
Yeah.
One of the reasons I pursued some training around this was because I did have a client years and years ago who had worked with a shaman, had a beautiful experience, right? The themes of it's all love, we are all connected, right? All of that was coming up in their trip. And because it was so lovely and beautiful and awe-inspiring, they thought, I can repeat this on my own. And so one weekend they found mushrooms, they, cleared their day, they took it at home by themselves. But what happened was all of that childhood abuse came up to the surface, right? And of course, unsupported, completely alone. I get a call on Monday morning saying, I am so dysregulated. Here's what happened to me. I don't know how to make sense of this. I don't know how to ground myself. Can you help me? And so in that moment, trying to coach somebody back into integration, right? Whereas it really solidified for me the importance of set and setting, and to really be able to give people a safe experience with these very powerful medicines.
And usually how long does a preparing portion take?
Yeah, that varies. If it's a client that I've been working with, so some of my kind of existing clients have decided they wanted to have this experience, and going through the Health Canada application process, we've already got a therapeutic relationship. Many of my clients, we've already been doing parts work, and so that preparation can go quite quickly for them. But for others, we recommend a minimum of 3-4 sessions for preparation, but we try not to have any kind of rigidity around that, because some people can need much, much more. Right? And a lot of times people come in hoping this will be the magic bullet. It's, the internet has said things like 10 years of therapy in one day. And I wish they would kind of pump the brakes a little bit with that, because it's setting up these expectations, right? And so for many people, they need much more preparation, especially with folks who have experienced trauma. That's not safe. And these protective parts are there for very good reasons. Taking them offline is putting somebody at risk of re-traumatization.
Yeah. And so after the preparation process, then I'm assuming that then it's the day of the trip.
Yeah.
And what's the process with that like?
Yeah, so we talk about that as being kind of very different than a recreational experience, right? We've certainly had some clients that have come through and they've had recreational experiences with mushrooms, and their eyes are open, or they're camping, or they're at a festival and they're watching all of the distortions. My hands look different. There's auras. All of that is externally focused. With a therapeutic journey, what we're looking at is they come in and we have eye shades. And so right away, the eye shades serve a couple of different functions. It invites people to go inwards, right? So instead of engaging with your physical environment, you're invited to go inside, and the eye shades help with that. We also have headphones with guided playlists. And the playlists it's almost like the third therapist in the room, right? Because these playlists can have music that is designed to evoke, music that matches the kind of predictable pattern of a psychedelic journey, right? So kind of like the hero's journey, where the music kind of calls you in to begin, and then it builds while clients are peaking. And then to be able to have kind of guided down, a lot of times people will say you lose track of time and space, but music is the thing that they can count on to keep moving forward. Right. And so if they're encountering a challenging internal landscape, knowing in 15 seconds the music's going to change and this will look completely different. Or even when people have otherworldly experiences and knowing that the music is going to help me land, right? The music's going to help me come back into the room. And so it does become the third therapist that can facilitate some of that.
Yeah.
So on the day of on the medicine day itself, we're kind of setting up a very different experience. We often start with rituals where we invite people to bring in sacred objects, things that feel meaningful, energies that they can carry with them into that space. And so we've had people bring in some really, really neat things. And then we've got a beautiful lazy boy that we set up, right? So it's really, really cozy for folks. We sometimes have, for clients who have had chronic pain, who think I can't sit still for that long, or I need to be able to move. We've got a thick mat that we lay on the floor so people can have options. And then the medicine day itself takes anywhere from about 4 to 6 hours, right? For the medicine for people to have those journeys. And we really work on making sure that feels unrushed, unhurried for people. And so when they start to land, very often psychedelics have this ineffable quality, right? The words can't describe what I've just experienced. Yeah. And so sometimes people will find themselves speaking in cliches, things like it's all love and we're connected, right? And I'm kind of plugged into the universe and I know everything's going to be okay, or I've got me, right? These beautiful sentiments that the words just don't capture the sacredness of people's experiences.
Yeah.
And so as they're landing, they might be wanting to put a few words to that, right? Or they might just want to sit and stare out the window for a little bit. And so all of this is really designed to be unhurried so that they can move through at their own pace with this.
Yeah. And on that same day, is there any kind of debrief or connection afterwards before they kind of get sent out on their way?
Yeah, that's a great question. So at Alethea, we have been having conversations with a group out in BC called Gathering Groups, and their model is a social care model. And so they don't actually do any individual trips with people. They always do it as a group experience. And I think there's something really beautiful about that, right? These medicines for centuries used by Indigenous communities were always used in ceremony and ritual. They were never meant to be consumed alone. And so one of the things, there's a lot of reasons why people want to have an individual experience. And there can also be a sense of, gosh, I've just experienced this profound thing, but nobody in my life knows what this is like. Who do I talk to about it, right? And so that can feel really lonely for people. And so when people are doing an individual journey, we spend some time connecting with their loved ones, right? How to support them, what might be helpful the evening of, in the days that follow. People don't tend to have many kind of lasting physical side effects, but there's this tenderness. People feel quite vulnerable, and the need for like increased attunement, having their loved ones be close, having space where there's no expectations, no decisions that they need to make, a calm environment. We found that a little bit of coaching for the people who are supporting after they leave with us, right, can be really beneficial for the after experience.
Yeah.
And then our very first integration call happens 24 hours later, right? So a lot of times our medicine days happen to be on Friday, and we're scheduling a call for Saturday morning. And so that Saturday morning is the first opportunity really for people to start to put words to tell the story of their trip.
Yeah.
So the night of, we tell people, don't think about it. Don't try and make meaning of it. Don't try to interpret it. Go home and just like you would describe a dream, right? Pull out a journal, start writing things down just so you don't forget, right? Or we've had people that have gone home and made art or do mandalas.
Oh, I love that.
Yeah, it's just what we're trying to do is keep people out of the cognitive mind, right? Is that it's so easy to get sucked back into that.
I can imagine that being very tough to be told, don't think about it, don't try to analyze it.
Right. But the medicine is still kind of in your system, right? And so that allowing yourself to savor in that space, right? Giving people a bit more time with it, because that window of neuroplasticity or even hyperconnectivity is really strong for those first couple of days, right? And so that's where the integration, having that start within 24 hours, where people can start to tell that these were the highlights, right? This was what was meaningful for me. And then I love, Jack Kornfield has this quote that says, first the ecstasy, then the laundry. And so it's this idea that we have to be able to, even with these profound experiences, have to be able to integrate them into our day-to-day life, or it's just another drug experience. Right. And so that telling the story of the trip starts to kind of mine for some of the gems, right? To be able to take some of those highlights for people and then turn those into meaningful actions. Right. And that's what creates all of the neuroplasticity, the new patterns that get established afterwards.
Yeah. So tell us a little bit more about that, because I did cut you off when you were talking about the neuroplasticity. So.
I know, it's so tempting for me to nerd out on that.
I love the nerding out though, because I think that, for some people it can be like, oh, you're just going on a trip. But I think when it is done in this way, in a very therapeutic way, there is so much benefit that can come from it because of that, the like neurological experience that's happening.
Absolutely. So I feel kind of two ways. There are parts of me that I have been fortunate enough to have very mystical, transcendent experiences on some of the journeys I've had. So I don't care about the neurobiology, right? Is that to be able to connect with some of the magic of the plant medicine. But I also can appreciate that when people are considering this, or when other healthcare providers are looking at, from a logical lens, help me understand why this is better than an antidepressant, let's say, right? Is that some of that information and the research can feel reassuring for folks. So essentially what we can look at is that in our brain, we have what's called the default mode network. And so I'm going to throw another analogy at you. If you think of your brain like an orchestra, the default mode network is like the conductor, right? And so it is responsible for our ego, our sense of self, all of the schemas around our identity, right? This is where those live in our default mode network. And so in this area of our brain, it's also what allows us to process autobiographical memories. And it's also what allows us to take kind of our identity and put it into the future.
Okay.
Right? So when we think about anxiety, even, I won't be able to handle this. I'm not capable. I won't be able to handle this. All of that is in our default mode network. And so this conductor, essentially what it's doing is it is coordinating the sharing of information between different regions of our brain, right? So all of that goes through, the orchestra is all managed through this conductor. And so what psilocybin does is it actually quiets that conductor, right? That's when you hear the term dissolving the ego, that's what's happening. Your default mode network is being quieted. And so in those moments when people are having this expanded state of consciousness, what's really happening is these different areas of the brain that haven't been able to communicate are now giving access to each other. Right. And so, again, when we look at this through a trauma lens, the repressed memories, the unconscious awareness, right, all of those things that we fight to keep out of our day-to-day experience so that we can function now come flooding up to the surface. Right. This is the big portal, right? This is the, oh my gosh, right, need to be prepared for this. And so the brain regions start communicating. But then a second thing happens, which is psilocybin works on your serotonin 2A receptor. And so this is what's responsible for all of that neuroplasticity. So it actually, increases the dendrites, makes these kind of more, increases the synaptic connections between all of the neuroplasticity. And so Robin Carhart Harris talks about the hyperconnected mind. And what he's talking about is those two things, the increase in neuroplasticity, but also the increase in communication with brain regions. So all of that is happening, right, 4 to 6 hours after taking mushrooms. And that window can last anywhere, for some people it's very short, right? It can last 24 hours, that window of increased neuroplasticity. For some people it can be 7 days, 30 days, or a lifetime. And the thing is, we can't predict how long that window will be. We have good markers, right? If you have treatment-resistant depression, there's a lot of rigidity there. And so that window tends to be small, which means people may need more than one trip in order to be able to make some of the changes to these deeply worn patterns. But for others, right, they could have this experience and have increased psychological flexibility that lasts a lifetime.
Yeah.
But because we don't know, we have to very intentionally work on integration with every single client that comes in, right? So that they can have the benefits of this, right? So if you've got a really small window, the importance of being able to say, this is what was meaningful about my experience. How do I turn this into changed behavior, right? How do I turn this into action in my life? That integration. So we do a call 24 hours later, we do a call 1 week later, we do a call a month later, right? So that people can start to kind of tweak those patterns to take advantage of that window.
Wow. Yeah. I like the calls, the check-ins, because then there's the accountability a little bit on continuing to do the work.
Yeah, absolutely. Absolutely. I'm just thinking of a few. I had a client where we did kind of a 3-month, it's been 3 months since her medicine day. And it was so beautiful because she was describing it as she was really looking forward to seeing me. And so when she came in, she said, it feels so far away, but it also feels like a coming home. And so that integration session was really about remembering, right? Remembering everything that the trip taught her and being able to come home to that information, come home to herself. And so the parts of her that kind of forgot about it was an invitation to reconnect with that in such a beautiful way.
Yeah, that does sound so beautiful. Before we were recording, we were talking a little bit about the 3 different medicines that are used and kind of the different views. I think I've had mentioned like creatine was definitely something that was heard a little bit more. Again, in like the media, we talked a little bit before we started recording about Matthew Perry's passing and that being something that was in a system. You had shared something there that there is that, how to do this in a safe way, not do like this isn't something to do recreationally in a way that is going to, get you to where you want to be, or it may not actually be safe at all to do that. Yeah. And tell us a little bit about like the 3 different types of medicine.
Sure. And so the 3 different types of medicines, there's a lot of different psychedelics, but those are the 3 that are legal in Canada, right? Ketamine, MDMA, and psilocybin. And I shouldn't say legal in Canada, but legal through Health Canada being able to help you to access that.
Right.
So you do still have to go through a process in order to be able to access any of those medicines. Ketamine is probably the most accessible. And so we see this often, it's being used in hospitals more frequently. There are clinics that have ketamine clinics. I actually had a client not too long ago who reached out who said, I'm wanting to have this experience at a ketamine clinic, but they don't have any therapy attached to it, right? And so ketamine can sometimes still feel quite medical model in terms of how it gets accessed for folks, right? And so I think there's much more conversation about how do we prepare and integrate even around a medicine like that one.
Yeah.
The difference with through Health Canada, so ketamine can be prescribed by a doctor, whereas psilocybin or MDMA, actually a doctor has to submit an application to Health Canada, and the application is for a special application program, SAP. And so what this is looking at is emergency medicine. And so ideally, Health Canada would prefer if people go through clinical trials, but if for whatever reason they're not eligible, that isn't a path they can go through, the SAP route becomes an alternative for them. And so for psilocybin, it can be approved for end-of-life anxiety or distress, as well as treatment-resistant depression, versus MDMA is approved for trauma. And so right now I've got a client who is a police officer. He's had a lot of trauma in his life. He had heard about psilocybin and actually came in that route, said, this is an experience I would like to have. But when I discussed with him, what I discussed with you is that it opens this big portal. And so even though you want to work on this piece, right, with all of the trauma history that you have, it might feel quite overwhelming to start there. So instead, what we did was an application for MDMA. And so MDMA works totally different than psilocybin. And so often viewed as an empathogen, heart opener. And it works by increasing the serotonin in somebody's brain, right? And so what that does is it allows people to go to these places with a reduction in fear, but an increase in love and compassion. Right. And so just the look on your face, right, you can see how with trauma that those places that we are afraid to go, right, or those moments that we carry so much shame that we've locked away, is that bringing more of that compassion to those parts of ourselves can be so valuable. And so MDMA in that way feels sometimes like a gentler approach for folks, which is why it's approved for trauma treatment.
Yeah.
But like we were talking about earlier, each medicine kind of has its own signature to it. Be very careful if anybody guarantees you any kind of results, right? Because MDMA, even you can have mystical, transcendent experiences. Everybody has their own experience with it, but there's kind of a different signature to each of those medicines.
You had described it as music, and I thought that was such a nice, like, it really helped me understand a little bit more that kind of tone that each of these medications has.
Right.
Yeah.
Right. So, I sometimes think MDMA can be like this folky, loving, right, flowing kind of music, whereas ketamine can feel more pixelated, right, like EDM house mix, loud in your face, right? Now, that's not everybody's experience, but it has kind of a different quality to each of those medicines.
Yeah. For folks who are maybe wanting or thinking that this may be a beneficial route for them to take, what are some important questions that they should ask a professional, whether that be a therapist like yourself or their doctor?
Yeah, I would ask about training. Because
that's important.
Yeah, that's important. That's important. And yet there are a lot of, Health Canada is one route, but there are a lot of people that are working for, and I advocate for this as well, to be able to have more of a compassionate access, right? And so to not have all of the restrictions that these healing medicines can have. But in that, it opens it up to a lot of underground work, right? And so what that can mean is there is a huge variation in training or experience that people bring to this. And so I don't think necessarily do you have to go to a trained professional, right? You don't need to go to a social worker. But the idea of one of the protections it offers when you have a regulating body is that you're held to certain standards and codes of ethics, right? And so some of the harms that can come in the psychedelic community is people are in incredibly vulnerable states. And this idea of dual relationships or boundaries that can get really blurry. And so having conversations around how do you negotiate therapeutic touch, right? What is, can they facilitate that? Can they have an intentional, clear conversation about what their policies are or how they work with you around that? Questions that I would ask, and this is maybe a bit controversial, but I think it's really important to work with somebody who's holding space who has also had their own experience. And I say that's controversial because in this field, sometimes we say, do you have to have had your own trip? Have you had your own experience with medicine? And there are some folks that don't. But I believe that you can't take people places that you've not gone yourself, right? And these expanded states of consciousness to kind of sit on the other side, right? To say, I'm mustering up the courage to be able to go there. Wanting to have somebody that can kind of be in that space with you feels really important about for me, I would want to know that with somebody I was working with.
Well, it gives a different perspective and understanding because you've experienced that as well, right? You've gone through that journey.
Yeah.
You know, maybe it's a different experience, obviously. I think each person has their own experience, but at least you're able to have an understanding of what that person may be experiencing.
Absolutely. And guaranteed it will be a different experience. But there's something about the ineffableness of it, right? I can't find the words to describe this. And I could say, oh, I know what it's like to sit with something so sacred, so profound, to want to share it, but not have the words that even touch that experience. Right? If you've not had that experience yourself, it's really difficult to relate to that.
Mm-hmm. Yeah. And so now on the other side, what is important for folks who maybe are in the profession right now? Some listeners that we have who may be therapists or who may be thinking about taking some training, like what's something that you would want to offer them in terms of suggestions or advice?
Yeah. Don't go it alone, right? There are, what I love about this community is there are all kinds of groups and networks that you can belong to, right? This work is not meant to be experienced on your own, and you're not meant to kind of be in this by yourself. And so what I have found is that in these psychedelic communities, people are very generous about sharing their knowledge, their resource, helping each other out, supporting as kind of we navigate this new landscape. So finding community to be able to do this in. There are a lot of, every day it seems like new training facilities are popping up. So spending some time looking at kind of the different options. For me, having an experiential component became really important. There's some really fantastic training facilities where it's more didactic or learning without the experiential piece or any kind of supervision or ongoing advocacy. So I did my training with Theracel, and I really appreciated the network afterwards, but as well as fighting for clients' rights and advocating for people to be able to access this medicine was really important for me when I was looking at trainings.
Yeah. That's wonderful information. And kind of to end off our discussion on psychedelic-assisted therapy, what's like a myth of psychedelic-assisted therapy that you want to debunk? If we could pick one.
Oh my gosh, if we could pick one.
I'm sure there's so many.
Well, it's funny that you asked this. I was out for dinner with a group of girlfriends, and we were, sitting around kind of playing that game, and somebody had said, what's one thing that you used to really believe, but now you've rethought?
Yeah.
And immediately I rethought drugs are bad. Right. So I grew up in the 80s with the Just Say No campaign, with the This Is Your Brain on Drugs, right? Drugs are dangerous. And so it really had me rethink the way that we can integrate some of these, the healing from some of these medicines that they offer. But in that preparation, it's having to address some of the concerns of those protective parts who are like, drugs are bad, or I'm doing something wrong.
Right.
And so I even had a client who had extensive, polysubstance abuse and had used mushrooms recreationally in his long history of drug use. And he had said, going through Health Canada made it feel like a different experience. There's a doctor in the room. My therapist is here with me, right? I'm having a very, very different experience in relationship with this medicine, right? He even started to talk about it differently. So the myth I would bust is that drugs are bad. To rethink some of that with the big caveat of, and they need to be treated with a lot of respect, right? And need to be done safely, intentionally, with a lot of love and care wrapped around it.
Yeah, I think we've had this conversation before in our previous episode on IFS. Not everything is bad, right? And I think in that case too, for this, right, it can be so beneficial for a lot of folks when it's done the right way with the right people and the right environment. And so there's a lot of things that kind of need to line up in order for it to be a healing process or a healing experience.
We talk a lot about set and setting, right? So set being the environment, but mindset being kind of the beliefs that you're carrying in with you. If those are not attended to, if you're at a rave or taking it in the back of a cab, right, is that those dynamic environments where it's changing can result in a very different experience than one that is psychedelic assisted therapy.
Yeah. Yeah. Is there anything else that you think is important for us to share with folks?
Oh gosh, I could talk about this for hours. For
We might need to
hours.
have
We
a
could do a
part
part
two.
2, part 3, part 4.
Yeah.
Yeah. I'm happy, if people want more information, if they want to connect around it, if they're curious about it, if people are, thinking about referrals or their own experience, I am so happy for folks to reach out.
And where can they find you?
So I own Inner Trailheads, and we do some of the integration coaching through Inner Trailheads, but I'm also a shareholder in Alethea Psychedelic-Assisted Therapy, and that's where we do all of our Health Canada approved work.
Nice. So if anyone is interested in reaching out either with questions or if this is something that they're wanting to try, then contact Melissa. We will put all your information in the show notes for folks as well.
Wonderful.
Thank you so much for being here. Like I said, it would be lovely to have you back and just do like a part 2 of this. And IFS
How many times can I come back?
I know. Let's see. We are wrapping up our first season, but it'd definitely be fun to have you back again for season 2.
I'd love it.
What's your social media handle for folks to find you?
Sure. Yeah, it's real simple. It's at Inner Trailheads.
So make sure to follow Melissa and us at Outside the Therapy Room Pod on Instagram and TikTok. And thanks again, Melissa, so much for being here. Thank you for listening to Outside the Therapy Room. This podcast is intended for educational and entertainment purposes only. If you reside in Ontario and are interested in working with one of our therapists, please visit our website in the show notes. If you reside outside of Ontario, a quick Google search or search through Psychology Today will help you find a therapist near you.